We're going to take you live to Brisbane now, where authorities are providing a COVID update.
Half of the cases we have seen in Queensland, we have seen since the borders opened last week on Monday, the 13th of December. In terms of testing, there were 29,918 tests completed yesterday, and I really want to thank everybody who came out on Christmas Day to get tested in the warm weather. So thank you very much for those people, particularly those who may have had symptoms of COVID, who've come forward to get tested on Christmas Day. The case locations, again, right across Queensland, they haven't changed, so I'm not going to go through the list of LGAs again. They're right across Queensland, from the north to the south. What strains are we seeing? It's about 75% of the viruses we're seeing are the Omicron strain, sort of stable at that percentage, around 75% Omicron, about 25% Delta. We're moving more and more patients out of hospital, people who've been stranded in hospital because they have nowhere else to isolate. So we have 714 people who are being managed very, very successfully at home with mild symptoms of COVID. We still have 93 patients in hospital, which includes the 7 who are actually symptomatic, who still have alternative places that we need to move them to. They may have other medical conditions, for example, but happen to have COVID. There are other reasons why they're in hospital. But at this stage, only 7 patients who are admitted to hospital with symptoms related or directly related to COVID, and none in intensive care, none on ventilators. In terms of vaccinations, being Christmas yesterday, neither the state nor the Commonwealth reported vaccination rates yesterday. I was asked a question yesterday about hospital staff who are in quarantine, who have tested positive for COVID-19. We have tens of thousands of healthcare staff in Queensland, so it is not at all surprising that some of them will get COVID, and that will continue to be the case, and that those numbers will rise. As of last night, there were 55 hospital and health service employees who have been confirmed to have COVID, and just over 300 hospital and health care staff are in quarantine as a result of a close contact, either in the community or in the hospital environment. There's one other issue that I just wanted to bring up briefly, and that pertains to the vaccination of pregnant women. We've noticed that there are a lot of women who are not pregnant women who have not been vaccinated against COVID-19. COVID-19 is a very bad infection to get during pregnancy. It's bad for the mother and it's bad for the unborn baby. The vaccines that we have available, the Pfizer vaccine and the Moderna vaccine, are safe and effective to give during pregnancy. So please, please, can I make a specific appeal to pregnant women to get vaccinated now, because you are likely, if living in Queensland, you are likely to be exposed to the virus in the coming weeks. And we know there's a safe and effective way of protecting you. Thank you very much.